I'd like to introduce our guest today, who is Dr. Grace Ryan. She is an assistant professor at the University of Massachusetts Chan Medical School in the Department of Population and Quantitative, not qualitative, Health Sciences in the Division of Preventive and Behavioral Medicine. She is a qualitative researcher who has conducted studies using both thematic analysis and rapid assessment approaches. Currently, her work is focused on identifying innovative messaging strategies to promote immunization uptake in rural and underserved communities. And today, we're going to be discussing Dr. Ryan's paper, Exploring Opportunities to Leverage Pharmacists in Rural Areas to Promote Administration of Human Papillomavirus Vaccine, which is published in the journal Preventing Chronic Disease. So welcome, Dr. Ryan.
Thank you. I'm happy to be here and chat about this work. It was a really fun project to do.
Great. So let's start by, maybe telling us about why qualitative methods for this particular question that you had, this particular research.
Yeah, so I will back up a little just to give a little more context on this project because this was one component of like a much larger study. And so our team was funded to they called it an environmental scan of barriers and facilitators to HPV vaccination in rural areas. It was a very specific call that went out through cancer centers. And so we were funded. And so we were doing this work across 7 counties in the state of Iowa. And these interviews with pharmacists were just one piece. We'd sort of identified these different stakeholder groups that we thought would be really important to talk to and to sort of understand what was going on and get a lay of the land. And pharmacists emerged as one of those groups. And so I think it's important just to, when you read the paper, to understand this was, part of this sort of larger study. And so at the time, there was not much work that had been done with pharmacists, particularly pharmacists in rural areas around HPV vaccination. The landscape of pharmacists being able to vaccinate has evolved a lot, in particular because of COVID-19 and sort of the efforts to get vaccines into pharmacies and make them convenient for people. But this work was done like back in 2017, 2018. And that was before pharmacists were sort of taking this more active role. And so since we were only working in these 7 counties, so we had a very sort of small catchment area. And also because of just the lack of work that had been done with this particular participant group on this topic, we felt qualitative methods were much more appropriate. We had only identified across these 7 counties 14 eligible people. And when you think about doing quantitative work with 14 people, you just don't get that, right? Like that rich insight. But being able to do interviews with them gave us a chance to chat with them. And part of this project was also really about developing relationships and sort of trying to develop potential interventions to build off of that. So for all of these reasons, we felt qualitative methods were absolutely the way to go for this group.
Great. So you managed to recruit 11 pharmacists to
Mhm.
participate in interviews. So how did you get these 11 pharmacists, and what kind of recruitment challenges did you have?
It was a lot of we had a great research assistant team and we just did a lot of cold calling. We're focused on community pharmacists, so that's people who are in small pharmacies, not like a CVS or like a Walgreens, which quite honestly just aren't there in rural areas either. These were 7 counties that were some of the most rural in the state. So this community pharmacist was probably the only pharmacist in this entire county.
And we're talking Iowa,
We're
right?
talking in Iowa, yes.
Yeah.
Um, And so we started just by calling, the main number for these pharmacies and saying, "Hey, I'm a researcher from the University of Iowa. I want to have a quick chat with you. Can you give me like the best time to call back?" And it took a lot of those phone calls. We actually tried to do sort of recruitment, consent, and the interview if possible when we were able to reach people, just to make these as quick as possible. We were calling people while they were working. So, we did offer them a gift card, but they were doing this work while they were trying to manage people coming in to pick up prescriptions. And so we worked with them as much as possible to find good times to call. It ended up being a lot of early morning calls and lunchtime calls, just to sort of find time when they were a little more available. But it was really all just sort of cold outreach. And then a lot of my husband works in sales and tech, and he always talks about this concept of pleasant persistence. And I think about that a lot with qualitative research recruiting or recruiting always. It's, this pleasant persistence of calling back and, just waiting until you get somebody to say yes.
And establishing relationships always helps too. So the interviews that you conducted were over the phone? Is that
Yeah, we did
way?
everything over the phone and we asked consent to record everything.
Yeah, that's good. Um, so did the phone interviews work out okay for you? Any challenges with the phone interviews?
I think the only challenge was we had some recordings or some interviews where, um, the pharmacist was like maybe working by themselves. And so they said, yeah, like it's pretty quiet right now, so I can chat for a few minutes. And then like somebody would come in to pick up their prescription and they'd have to put us on hold and we'd have to continue the interview, which is obviously not ideal because you lose some of that back and forth and flow. But our goal was to make this as easy as possible for them. We knew that these were just not people who we could say like, "Oh, could we call you at night when you're like off from work and talk with you then?" We just did not feel that was an appropriate way to go about this. So we sort of made some um I guess concessions just to, how we would have an ideal interview, which is, somebody sitting in a quiet place and we're now I would say like my ideal is to be, if we're not in person, a quiet place. They're on Zoom so we can talk face to face. And 2018 was like really pre-Zoom. I used to do all of my interviews, over the phone or in person, and now they're all on Zoom. But we just recognized with this population, that was not something that was going to happen. And we did have some folks who we were able to call and they said, "Oh yeah, I have a coworker here right now, so they can sort of like man the front desk for, this time while we're doing the interview." But we still weren't getting people. I imagine they were, taking this call still in the midst of the pharmacy, not, in a private location. That said, we were really happy with, the people that we got. We got 11 out of 14 of our intended participant group to, talk to us, and so it was a barrier, but it was not one that I felt was sort of detrimental to, the project.
Well, they weren't really talking about sort of very personal or sensitive topics. So the privacy situation probably would be fine
Exactly, like, we discussed it sort of internally once we realized, like, how people were doing this and decided that since we weren't asking about specific patients, and, we're asking them very much just about what their jobs were, which is something that they're probably discussing with their coworkers or in public in many cases anyways, and we, were mindful if we felt like things were um, of course, we always remind people, right? Like, this is confidential. Anything you say, we're going to report an aggregate. We won't attach your name to it. We are very mindful that we said we will be reporting on which 7 counties are included in this project, but we are obviously not reporting the name of your pharmacy. Or any identifying details, and so we felt like for all those reasons it was okay to have this approach where they weren't speaking in private. But yeah,
How long were the interviews?
I think they averaged about 10 minutes, so these were pretty
Oh,
quick interviews.
yeah.
Again, in, sort of the ideal version, right? We'd wanna have these longer in-depth conversations, but sort of it's always that balance of, you know, how do you meet people where they are and get them to participate in a way that's meaningful without, like, totally overburdening them, and quite honestly, I think if we'd asked these people for half an hour, 60 minutes, they would have said, like, "I absolutely don't have that during the day."
Why do you think you lost the three that you did?
I
Three.
think it was just we had written in our IRB we would follow up either 4 or 5 times, so I think we just sort of got unlucky with those 4 that we reached our max and they were not able to participate any of those 4 times, and because our IRB we'd written it in a way we, couldn't, we couldn't continue.
Change it.
Yeah.
Okay, well, you did it. You got the 11 is a good number. And so, when you got to the point you've collected your data, you've got transcripts, I'm assuming you're all transcribed, and then you got to the analysis phase. So, what approach did you use once you had your data now ready for analysis?
Yeah, so we followed thematic analysis pretty closely. I'd say, completely closely. And so we got our transcripts back, and the team that did the interviews was also the team that did the analysis, which I always like because you have that continuity and, you've sort of already started that first phase of thematic analysis of familiarization with your data. And so we had a team, I led the team, and then we had two master's level graduate research assistants with us, and the three of us, in this case it was only 11 transcripts, so we all read the transcripts, again at sort of the conclusion of interviewing, and started to discuss potential codes in the code book. And we met, I want to say, while we were doing this project, we met really on a weekly basis to sort of maintain, um, flow and make sure we were capturing everything. And so we started the process of developing our initial code book. Everybody came and proposed sort of their codes from doing their reading of these 11 transcripts. We went through, I think one or two meetings of developing this code book and having really clear definitions. These were two research assistants who this was their first qualitative project. So we really wanted to, do sort of as much upfront to have the coding be as close to, we've developed a code book that's easy to use and apply. So we used, I'm trying to remember, we did not use any sort of software. I think we actually just coded using Microsoft Word in the comments, given that it was only 11, it was only 11 interviews. We felt like that was manageable. I think our team just didn't have an in vivo license at the time, and it was sort of pre-deduce when, deduce has made everything a little bit cheaper for this kind of work. But it was the three of us, it was 11 transcripts. And so we used the code book and applied it. And then we worked together to sort of create this Excel document where we pulled out codes and the appropriate coded extracts to be able to use that to sort of generate the themes that ultimately are what we reported in the paper.
And with 10-minute interviews, I mean, that's not a massive
Exactly. We weren't
transcript.
looking at,
It's pretty short.
25. Yeah, it was not like 25, 30-page transcripts. It was probably
Right.
5 to 7 pages.
Yeah.
So
Made it
it's
manageable.
straightforward, which is nice for, I think with thinking about these small scale projects, it was a good example that you don't need to be spending thousands of dollars on software, and it's really a pretty manageable thing to do.
So, when you were all done, you got your results. Now you have to write them up. So, what was your experience writing up your final report and then thinking about, okay, where am I going to publish this?
Yeah, so there was, a component where we were, including these results as part of this like much larger report across all of the data collections that we did as part of this environmental scan. And so, for that report, our write up on this was like quite brief, and it was, 1 to 2 pages in this, bigger report that we produced. But for the paper, we actually in some ways got lucky. Preventing chronic disease had a specific call for papers at the time that was looking at the role of pharmacists. And I can't remember if it was the role of pharmacists rural areas or the role of pharmacists in vaccination, but it either way it directly addressed sort of what we had done. And so when we saw that, we thought, oh, this is where we have to submit this paper. We recognized that it was only 11 people, which, despite the fact that we felt we had really good saturation, certainly like we reached, I think, as many people as we could reach in this area that we were looking at. We know that sometimes publishing with 11 participants is harder in some journals. But
Challenging.
we felt like, oh, this is this opportunity. They're looking exactly for the kind of work we've done. And so we did choose to write it as a brief, not a full manuscript, which I think is sometimes appropriate for these smaller scale projects. But we sort of worked quickly to turn this manuscript around to have it be able to be submitted for this special issue that Preventing Chronic Disease was doing. And we went through a round of reviews, and I think reviewers had fairly minor comments, if I'm remembering. And so we I think just sort of got got this right time, right place, with the data that we were sharing. And again, this was in sort of like the HPV world. This was like there's now a lot of work on the role of pharmacists in HPV vaccination, but what we'd done was some of the first qualitative work on it, and I think that helped us too. It was sort of a new topic in an underexplored area in a journal that was very interested in this specific project at the time.
Gosh, talk about luck.
Yeah,
That's
exactly.
amazing.
Yeah.
So I could tell by reading it that you were probably faced with word count pressure. Like you had to squeeze everything into a fairly brief, as described by the article type, number of words and pages. So how did you work through that?
I think, you know, we certainly the first draft we wrote was not very brief, as is sort of like always our writing, I think. And we went through a lot of internal edits. And ultimately, our results also, we were right. This was not like a theory generation project. We weren't using this approach where we felt like we really had to go into nuance. We were asking people about what they did, in their daily work, and how they could imagine, expanding their role a little bit. And so our results, we felt did not need an enormous amount of exposition to sort of contextualize and explain them. We were able to, I think, pretty succinctly cut down into, these are really the key points and the key takeaways. We thought a lot about who our audience might be for this, and we felt, potentially rural pharmacists, but probably other researchers who are trying to start this kind of work. And so our team spent a little bit of time thinking about, okay, what are the three things that we want people to take away from this project. And we really tried to sort of center our results and our discussion, which are the pieces that get so lengthy around like, if somebody's reading this, just what are those like sort of 3 to 4 key messages that they need to take away from this? And sort of we just cut everything else out. And then, of course, being able to use tables for qualitative work where you put all of your quotes in a table rather than having them in the text. So some of that like little workaround to be able to still get participant voices in without taking up too much of the word count.
I thought the use of your theme and quotation table was really excellent. I've, seen that elsewhere as well. In fact, that's sort of the standard that I use too, because if you write your results section like a narrative, all of a sudden your word count is through the roof. Yeah, so that was good. And I noticed your demographics table. You had a fair number of demographics that you collected from these folks. How did you do that?
We I'm trying to remember now. I think we just collected them like sort of last part of the interview was we just asked people these quick demographic questions. And that was also because we asked those demographic questions across all the participants across all of our data collections. So for this project, in addition to talking to pharmacists, we talked to dentists and medical providers and community-based organizations. And so we wanted to be able to have demographics when we sort of produced this like bigger report that showed across everybody.
That, it sounds like a very good method. You know, I mean, as I was reading through, I thought, how'd they grab that stuff, especially if you're interviewing remotely, and that was probably before, well, you could have done a Survey Monkey thing or something like that, but that's like an extra step
Yeah, we
that you
thought about doing that, and I think just decided that we probably wouldn't get very good response, and we just wanted to try and grab everything at once. I do feel like there was maybe one person who we had to follow up with, because one of the things that we asked was like, "What other vaccines do you offer?" And when we caught them on the phone, they said, "I'm gonna have, like, I just
I gotta
started," or,
go.
something, I don't know. And so I think we just followed back up and said, okay, well, like we'll call back, like maybe if your manager is around and can tell us this information. Because obviously that's not just, specific to them. That's like a
Sure.
demographic of their pharmacy.
Yeah, yeah. So that worked out. So if you had to do the study all over again, would you do anything differently?
Um, I mean, certainly expand the scope of it, right? We did this in a very small area, and we got really fascinating results, but it, is certainly small sample size limitation. Although I would knowing what I know and sort of like about this topic, I bet we would get similar results across other rural counties. I think the the only thing that I might change is trying to figure out a better, I don't know if it's a better recruitment approach, or maybe being able to offer more of an incentive so that we could sort of reasonably ask people to do these interviews on their own time rather than during working time. I think certainly being able to even add 10 to 15 more minutes to these interviews could give us a little bit more context and nuance to some things. But I think to be able to ask somebody to say like, "Hey, can you do this interview at, 7 p.m. at night or, 9 a.m. on a Saturday?" I do feel like you have to offer people like a significant amount more of an incentive to do it. And that was just not in our budget for this project.
But that's usually the case with, graduate students when they're doing their research. They don't have a budget, you know. And in-person interviews too. I mean, that's even more of an imposition because you're asking them, e- well, sometimes you're asking them to travel somewhere, sometimes you're going to them. Sounds like travel would have been a big issue with this.
Yeah, a lot of the places we worked with were, we were obviously located at the university and, an hour and a half, 2 hours away. And so we did not feel like in person. Our team probably would have been willing to do it, but again, you think about the money and the travel time and
A 10-minute interview
for a
is
10-minute interview, just
right.
not going to work out. So
Doesn't make
I think
sense.
that would
Yeah.
have been the big thing to figure out a way that we could feel ethically okay about recruiting people to participate in these interviews on their own time so that we could have a little bit more time with them and certainly more sort of like concentrated focus time.
So if you were going to give advice to someone who's new to qualitative research, what would you say?
I think the advice that I always have for people is to just jump in and do it and find somebody who's willing to sort of mentor new students. I think that the best way to do, I mean, all research, but I really think this is true about qualitative research is the act of doing it and sort of shadowing a team who is doing qualitative work. I think it's really hard. I think we do such a good job of teaching qualitative methods, but you don't really know what it's like to do an interview until you do it. And so I loved this project because it was also me getting to work with students who were doing this for the first time. And so we had a lot of conversations about, not just like the work that we were doing, but sort of bigger picture conversations about how do we contextualize this, like as a, in research and in qualitative work and what, are we bringing into this? So I always say, if you think you're interested in qualitative research, try and find somebody who you can shadow for a project and, listen to interviews and be trained in how to do them and sort of shadow the analysis process. Because I just think it's the only way to really get like a true hold on like what this is and how much you're going to like doing it or not.
A lot of steps and a lot of nuances
Yeah.
to doing this kind of research. Well, thank you so very much for spending some time with me today. I really do appreciate it, and this was incredibly valuable.
Of course, I'm happy to, and it was fun to sort of revisit some work that was earlier in my career, and think about how things have evolved since then. Even though it doesn't feel like I did this work that long ago, a lot's happened. So thank you for inviting me to reflect and join the class. I'm really, it was fun to do.
Great. Thank you so much.